for joining us again this week, your source for information, entertainment, and community. We're glad to be joined today with the Cabarrus EMS. We have Justin Brines and Jimmy Lenz joining us today.
Thank you. Yes, so Chief Lenz, he is the chief of Cabarrus County. He has been with EMS since 1990. It's a long time. He was a SWAT medic for 17 years here in the county. He holds numerous FEMA certifications, and he lives in Concord with his 2 daughters. And then we have
wife.
Oh, and wife. Sorry,
Sorry.
Yes, and she's the most important. Yes. Okay. And we have Deputy Chief Justin Brines. He's been employed with Cabarrus since 1998 and currently serves as the Deputy Chief of Administration for Cabarrus County EMS. He served as a SWAT medic for 15 years with the City of Concord Police Department. Since 2000, Justin's been actively teaching EMS courses, including EMT, paramedic, EMS management, and other curriculum classes. And he lives in Concord with his wife and 3 daughters. Lots of daughters all around.
There are ladies everywhere.
Well, let's start off with kind of what got you into the EMS services and what drew you to that profession.
You want to start?
And it sounds very cliche, and it's a common answer, but truly the interest in helping people, helping our residents of Cabarrus County or the population traveling through Cabarrus County, and it just worked into a perfect fit in EMS. I knew I wanted to be in public safety, but I didn't really know which branch, and honestly, it's a calling, and it's been very, very rewarding for me, and I hope I've done the same for the field.
A similar story for me. I was 16 and looking for something to do with spare time. I was still in high school, and I joined Odell Fire Department like the day I turned 16. And at the time,
Ready to get in there.
Well, yeah, but it was more just at the time. It was a good place to be. It was I was around people who were good influences, and so I didn't know if I wanted to do law enforcement, fire. I really wasn't thinking about EMS till I got my EMT. And then realized that was it. And so from there, got hired with the county in '98, part-time, went to paramedic school, and it's all I've ever done. So yeah, I wasn't really, it's a career and a profession that I didn't set out after. It sort of found me, but and then after I did all that, I of course kind of went back and got the education that goes with it and all the things, but I kind of had the job before all the education, other than just my paramedic. So,
So being in it for so long and with the county for so long, you all have seen it change tremendously, which means this year y'all are having the 50th anniversary of EMS, which is amazing here in the county. So what kind of big things are happening? I know you have the new facility coming up. Can you tell us a little bit about what all that's going to offer and how much it's going to change kind of the direction?
As far as the actual 50th anniversary will be October 1st, which coincides with our grand opening of the headquarters very nicely.
You all need to come out too.
Yes.
It is a public event. We will certainly share the information. But the grand opening is October the 4th at 6 p.m. We are very, very excited about the new opportunities the headquarters brings. The building we are currently in was built in 1980. When I was hired in 1990, I was the 36th employee. We now field a staff of 170, and we are currently in the same structure we were in 1990 when I was hired.
So you definitely outgrown it.
We have outgrown
Put it
it.
to its full use.
We have got the best of it. We have made it work for many years, and it has worked fine, but we have exceeded the capacity of that structure. The community has also obviously grown to require us to meet that demand, and the facility we're in currently is our administrative headquarters. Where we're going is a better location. It's more central. It's not necessarily in a neighborhood like we are now, and there's different aspects of it that are very appealing for an EMS headquarters.
Yeah, so we'll have training, very state-of-the-art training facility with simulation, which in healthcare is kind of the way to go now. There's so much that we can do, in a simulation lab that really is as close to reality as possible. So we'll have that. We'll have all of our logistics, being able to restock trucks, bring in our supplies. Right now we're just in time. Basically, we don't have anywhere to store the extra stuff, so we get deliveries every day. So we'll go to a little more relaxed delivery schedule with supplies. We still have stations throughout the county, and we'll maintain those. So it's important for folks to understand that we're in your neighborhood in Mount Pleasant and in Midland and out in the Odell area. We have stations there, and we respond from there. But this will be the hub that we come to for training, for administrative stuff and for supplies, but we'll still be out in the county as well. And you mentioned the 50th. It's important to remember that EMS in general is a fairly young profession. So there's a lot of EMS agencies in North Carolina that are celebrating 50 this year. The North Carolina Office of EMS is celebrating 50 this year. So 73 was the year that a lot of counties began to take over the service. Prior to that, it was private ambulances, funeral homes, that kind of thing. So 50 years sounds like a long time, but when you think about we have staff, and one of our retired directors is coming who was with the county in 73 when it started. There are like people still alive who've done this the entire time. Like we're not hundreds of years old like the fire
But
department.
it's good that they get to celebrate it and see how much it's grown. And the simulation lab sounds awesome. So how often do you all have to train? And medically things seem to move quickly, and new policies are constantly updated. So with that,
New
what
legal
all
requirements.
Yes, exactly. So with that, what all will you all be able to actually train and continue the level of care?
It is continual. So like the training, and that's the thing that this facility will allow is for our folks on duty to have a place to come in for 30 minutes and complete a skills check off or something, where right now we're blessed, but we have to go to the 7th floor of the sheriff's office. It's hard to get in and out, and the equipment that we have. So because of the fact that we do train all the time pretty much, we have quarterly education days where we do some more lecture type style, but a lot of our stuff is on duty, and a lot of it is skills based, like you said, and it is ever changing in healthcare, no different than the ER or any other profession. So there's we get new equipment, everybody has to be validated and all that stuff. So it really is. Somebody asked us this week, how often will you use these training rooms, and it's probably not daily in the scenario rooms, but at least 3 or 4 times a week we'll be rolling through. Probably when you add it up, it probably will equal close to 40 hours a week by the time
And
everybody's
it's great
done.
for the employees. You don't, they don't have to go to other colleges, things like that you can offer it right here for them to be able to do that. So I think that's
We are very excited.
Well, just for public knowledge, this will be outreaching to the fire departments as well.
Oh, awesome.
Under the Cabarrus County EMS system plan, every fire department in the county provides first responder response. With that being said, they have training requirements to be met as well. And we will certainly welcome them into the state-of-the-art facility. We want it to be utilized by everybody that could benefit from it, and that would certainly include all the fire departments within Cabarrus County and the municipalities.
Well, that leads into a great question also, is how do you guys coordinate with the fire department and those other medical services?
Sure. Just a quick rundown, and Chief Brines can certainly take it and run too, but a 911 call once made is triaged by a process called Emergency Medical Dispatch, or EMD. EMD then categorizes the response A through E, with A alpha being non-emergency, not lights and sirens, so a stable situation, not an emergent situation, through E echo, which is the worst of the worst. It's a bad situation, it's very time sensitive. The non-emergent, the A calls, do not get first responder response. It's just simply a stable, or it's triaged as a stable situation that we don't want to tie up unnecessary resources by bringing a fire truck out, by bringing firemen out, in many cases volunteers that would leave their home.
Right.
It's something that the 2 paramedics or 2 EMS staff members, one being a paramedic and the other could be a basic EMT, but it's deemed something they can handle without the first response. From B through E gets first responder response by your local fire department. This reduces response time because there are more fire departments in the county just by statute than there are EMS stations, and it minimizes response. It gets help there in a very efficient and timely manner, and we simply can't put a price on the value of the first responders to us. They're amazing. They're super eager to help. We are very fortunate in this county to have very good first responders and a very good system, and it's very beneficial.
And it's fire department's a federal mandate. So, most folks may or may not realize that, they're a federally mandated service. So you see fire departments on almost every corner. And so on those fire trucks are EMTs, and those EMTs are in our system plan, meaning they fall under our medical direction. They have to, they have to check off on the skills that an EMT can do. Some of them, they can do it at their department, but ultimately they fall under Dr. Catherine Waggy and Dr. Josh Hall, who are our 2 medical directors. And so when 911 is called, even though it may take us 6-7 minutes to get to the call. If a fire truck gets there in 2 or 3 minutes, there's a trained EMT who's part of the EMS system plan immediately providing care.
Which is good. That
Yeah.
means care can go ahead and start, and everybody gets what they need.
And in the immediacy of an emergency, there's really nothing that an EMT can't do that a paramedic can, vice versa, when it comes to just basic airway, CPR, hemorrhage control. So they're really providing the immediate care. And then the ambulance gets there with all the equipment, and if they need advanced life support. So it really is Jimmy said it, but it's not, we can't exist independently. Like, it's something that, we have to work together. And most folks just think they call 911. A lot of folks don't know who's going to show up. They don't even realize it's a county service. But then we get the other side. Well, why are these fire trucks running around? Do you need this many people? And until it's your emergency, you don't, right?
The more the better.
Yeah, until it's your emergency, then you want everybody. So y'all just have to trust us that we follow. And there are policies, as Jimmy said, that determine who comes, how many people come, how fast we come, all those things that they're evidence based, and we do that so that we're being prudent of tax dollars, we're being safe, we're not running people, off the road to get to a stubbed toe as much as we can. So it is there's quite a bit that goes into it that folks probably don't realize, so.
Well, with that collaboration and communication, that's even better that you guys are training off the same equipment and everything, and it's all up to the same level as well. That's awesome.
That is invaluable. And you'll find this across any EMS service, most anywhere, especially in the southeast area. That's kind of how it's run. You go up north, there are more private services kind of thing, but the delivery model in North Carolina, it really is efficient and across the state. So
now with that, because you all have a lot of specialty teams, so you also train with the police departments, do different things with the hospitals, things like that. Can you tell us kind of what all those different teams are and a little bit about?
You want to take that one?
It doesn't matter.
We have so we do, what we found is that it's easier to take paramedics and train them in some of the specialties of law enforcement and of hazmat than it is to take a law enforcement officer, police officer, and train them to be a paramedic. Because there's a lot to it. Not that they couldn't do that, but it's almost a whole shifting gears. Whereas we can take a paramedic, train them on basic firearm safety and moving through a house, that kind of thing. All the things that we would need to do, it's easier to train that way and then put them as part of that element. So we have tactical medics who support all three teams in the county. So Kannapolis PD, Concord PD, and the Sheriff's Office, all three have a special response team, SWAT team if you want to call it that. But it's basically a highly trained team that can come in and take care of situations with a little more equipment and gear and make it safer. So we put medics on each one of those teams. There is an EOD team, or an explosive device team in the county. The Sheriff's Office actually has a team that is really a regional response team.
They have the fancy robots.
They do.
Yes.
And so we put medics with them. They're trained in hazmat and EOD.
What's EOD?
EOD, yeah. So
Emergency
explosive ordnance device, or EOD, I'm sorry. So basically a bomb. And it doesn't necessarily have to be something where somebody is trying to do harm. It could be, we have people that are cleaning out their, they buy a house and clean out a garage and find a grenade and it may not even be active, but you don't know. And so they come make it safe, that kind of thing. So it's not always like people trying to do harm. It could be, there's tons of stuff that goes along with that. So we do that. We have over the years supported stuff like Swiftwater. We have a state medical assistance team, or a SMAT team, that is a statewide resource. We have kind of shifted gears with that and turned it more into a large venue or large gathering, mass gathering type response, because we have the race, we have NHRA, NASCAR, we have concerts out at the Speedway. So all of our stuff in that response is typically to deal with larger number of patients than normal in the heat, or folks who may be under the influence of drugs at a concert, where we have to help them through that process. We can set up a tent and manage that kind of way. So we do have response there as well. Am I forgetting any? Because
we support 2 hazmat teams, being one at Concord Fire and one at Kannapolis Fire, and again, that's a specialty training source, or specialty avenue of training. So we do have hazmat medics on those. And Justin mentioned the racetrack. We have track medics. NASCAR requires and mandates specific annual training to meet their needs with the NASCAR events here, and then that overlaps into the NHRA, or the last weekend we had the Supercross here. So the track medics handle that. The neat aspect of all this is you can point and direct EMS employees into areas of interest. Mine personally, I had an interest in law enforcement. I had an interest in tactical response, and that was kind of why I did it for 17 years. I had no interest in hazmat. That's something that really never interested me, but we've got folks that do. So being able to point those folks, and honestly, even down to recruiting, when we do interviews, it's quite common for a new applicant to come in and say one of the things that appealed to them were the specialty team offerings that we had. So we use that a good bit in the recruiting side of things too.
I think it's great. Not only do the paramedics serve the citizens, but they get to serve all the other departments in the county. So it keeps kind of everyone on the same page and working together. And I think that's great. It's kind of like they get to give back to other departments that come out and run calls with you and help you out. So
and I'm thinking of, even if you're a young person and you're not sure where to go in your career, and you do this for a while, you get some training, you get some hands-on experience, and then you have a valuable skill set you can take anywhere.
We've had quite the shift to folks in our profession who come in to get that experience, to go to PA school, to go to med school. And at first, years ago, it was kind of like, well, we want somebody who's going to work here for 30 years, like everybody would, right? But we realize now that that's it's just not the case. And so we have really embraced that subset of employees because they make great employees. They need something from us. We need something from them. They get really good patient contact hours. And honestly, I don't know many PA schools that turn down paramedics because they know they've had that experience. So while we still like to have a mix of folks who want to do it for 10, 15, 20 years, we know that, if we can get 3 to 4 years out of somebody who's up front with us and says, hey, this is my goal, we're going to support them through that. And it's working. I mean, we have to fill positions a little more frequently, but we embrace that and we know it.
I think it's they learn so much that they just want to serve in a bigger capacity.
It is.
Yeah.
And so, that's an interesting part of recruiting and staffing now that we, has kind of shifted over the years.
Now, can you tell us a little bit about the community paramedic program? Because I know that's a program that's also, it's been around for several years, but it's a newer program. And do all counties?
Not all of them.
Yeah.
At the last check, and don't quote me on this, but there's around 20 to 30 counties in the state, maybe closer to 30 now that have it. So we're not to half yet, out of the 100 counties. So community paramedicine is really the easiest way to describe it is it's a non-emergency response that EMS provides where we go into the community and fulfill a need, whatever that need may be. Typically a program starts with like a gap assessment where you look at, and ours started with an ask from the hospital basically. Years ago they had stroke patients who they didn't need home health, but they didn't qualify for it, but they needed somebody to help them with medications and navigating the system and all that. And they had a higher than desired readmission rate. And if anybody knows anything about healthcare billing, for certain conditions, if you get readmitted in a period of time, the hospital has to basically, pay, or they have to eat that bill. So they came to us and they said, hey, what can y'all do? So our program was initially designed on readmission prevention with the stroke program at Atrium Cabarrus, which at the time was probably still, I don't know that it was Cabarrus Memorial, but I believe it was Northeast. So before the merger with Atrium, and so we grew from that. So we go out, they go into the home, they make sure folks have their medicine, they're taking their medicine, that they have food in their fridge, that if there's trip hazards on the floor, they address that. If there's light bulbs burned out, to keep these folks from falling. It's really a holistic, approach to healthcare. And then, they have contact. We can go back if needed. Some folks just need one visit, but we establish contact with them. We switched. We still do stroke, but we added the coronary folks who've had coronary bypass. We go see them. If they have complex medical conditions where they have a ton of stuff going on where they need managed care, we go out and see them. COVID kind of added a whole nother layer because then, so Atrium started doing the hospital at home, and everybody's probably heard of that. If you haven't experienced, you have a loved one. That is community paramedicine, but it's just the service being delivered by the hospital. But they essentially come into your home and bring a virtual visit with practitioners. and it's paramedics doing the assessment. They're kind of the eyes and hands and the note taking and, looking at the patient, and the provider, is on virtually. So they're doing, Atrium's doing it in a little different way. One thing I'll say, every community paramedic program is organic because it starts in the community with the need. So some community paramedic programs focus hard on mental health and substance use, and that's all they do. Some focus on readmission prevention. So it really depends on, what the community needs. But like I said, EMS, we know the community better than anybody. So we can go in, we already have a level of respect that's established, and folks trust us and that kind of thing. So ultimately, we're saving the hospital money, but we're also providing a service to our residents that there is, for us personally at Cabarrus, we do not bill for the service. That's twofold. One, there are some now, when we started it, there was no billing code, but now we can bill for it. But we've chosen not to because we can sort of do what we want to as far as overlapping other insurance providers. And I don't mean do what we want to, but like, we don't have to worry about, well, they're going to get billed twice, whatever. We just go out. If there's a need, we fill it. So the county, the hospital does, Atrium Cabarrus does give us, we do have a grant from them, an annual grant that helps because we're saving them some money, but the county also provides resources as well for staff and vehicles and that kind of thing.
So if an individual wants to get connected with that program, do they go to EMS? Do they go to the hospital? What would be the path forward for them to be connected with that?
So if they're in the hospital in a certain service line, they're going to be offered the service before they get discharged, typically from case management. So that's one way. If they don't, or if somebody's has a loved one at home that needs help with a shower chair or whatever, so you can call 920-2600, 920-2600 is our main line. Option 6 will get you community paramedic. You can also go to the website, cabarruscounty.us, and if you just type /EMS, there's a place on there with all the contact information. And we had a family show up the other day it was a Hispanic family from out of town. The lady had a knee issue, and she was like, I need a wheelchair. Well, before she left, we had her a little rolling walker. We have a building out back full of all sorts of things that people let us borrow, and we sent her on her way. We're like, bring it back when you're done. And they had heard of us through a friend. So, we do all sorts of stuff. It's really cool because you get to do.
Well, and it bridges kind of that gap, between the hospital
Yeah.
and the need for 911.
Yeah.
But then it also, stroke, things like that, that's life-changing for anybody in the home. So to be able to have those extra hands to just kind of help guide them through that whole process is really
Well,
important.
another avenue of that too that's common is folks that we see frequently, that we see often. We will identify them, and the field EMS staff that are on ambulance can make recommendations to the community paramedic program and follow up and see if that is a need that we can assist the citizen with to minimize their need, to help their situation and maybe minimize the need for calling EMS as frequently as they do.
Now, other things you all do in the community, you also teach community CPR, you can go out for the AEDs, locating for business, things like that. So what kind of things, if residents want to call out to be able to, hey, I have a business that wants to, learn CPR, get their people trained, things like that.
An efficient approach we have found to that, and just to be totally transparent, it was quite often we would have someone call and say, oh, I've got 50 people interested in a CPR class. So we would staff to go out and train 50 people for CPR and have 6 show up on Saturday morning or Wednesday evening or whatever that it was. So we will certainly still make exceptions and do things for folks like that. But what we've been doing recently is having a class at our facility, which is now going to be much easier since we're going to be, after October 4th, we're going to be located on Cabarrus Avenue in a very central part of the county in a very easily accessible building. All our equipment will be in one place. So quarterly, we will offer these classes on site. People can come. It's no charge. Unless they would want a CPR certification from
Actually, we're paying for those now.
Okay.
Yeah, we have a grant through race cars, so there's not even a charge for the car.
We do have grant funding, and I'm sorry I overlooked that, but it is something that's free. We are involved in the race cars program, which is an initiative doing cardiac research. So one of the big things, truthfully, the primary goal of that is to teach a lot of people in the community CPR. Because as you hear regularly on media outlets and everything, early recognition and early CPR is what makes the whole difference in a cardiac emergency. So the more people that know how to deal with it, the more we are benefited by the community knowing.
And then those signups will be on our Facebook page.
Okay.
So if you go to events, right now it's a little dry because we're trying to get in this building, so we didn't want to schedule them and have to move them and all that. We definitely will have them headed into November and then quarterly thereafter. But as the chief said, if you've got a group at your church, we will come to you. That's not a problem, but we are trying to shift to a model of come to us because all the stuff is there. We can even use a simulation lab to kind of simulate like in a mall doing CPR. So, we're hoping to do it more at the headquarters, but we love to train folks in CPR because that's really what makes the biggest.
That's great. We can link all that.
We'll link it all in the show notes for you all as
That's
well.
great.
Yeah. Now, are there other, besides coming out to the community, I know that you guys out at the Cabarrus Fair this weekend showing models like that. Do you guys do a lot of that, like going to schools or going to events and expos to engage with the community on that level so they know where to go for those classes?
We do almost constantly. So we, and I don't say that because we mind it. It is great. Like we get we get requests all the time to come into a school, like a HOSA class, like health occupations, to come to an elementary school and let kids climb on the ambulance. And so it is almost every week, at least a couple events here and there. The fair is always a great, the Cabarrus County Fair is a great place for us to connect at our CPR booth and folks come in. We have a ton of we have ride-alongs, so like if somebody ever does want to come and observe, we can put you on an ambulance. We can do up to 2 12-hour shifts and let you kind of see what we're all about. If you just want to see the administrative side, like ride around with us for a little while, like we are literally, and I've used this word before, we are an open book. We will show you anything you want to see when it comes to behind the curtains. There's nothing that we don't, tour people around. So if somebody's interested, same contact, reach out to us and we'll show you around. And if you want to jump on an ambulance, we'll put you there too. So.
That's great.
So I know the cops and the firefighters usually get all the love for the groups and foundations, but we couldn't do it without you guys. So if the community wants to support you, what are the best ways the community can support you guys? You guys have a foundation, you have a nonprofit you work with. Can they bring you cookies? What is the best way for them to show their love and support for the EMS?
Cookies are always appreciated. Yes, that is a way. We, and I'm kind of referencing back to Sheriff Shaw's presentation last week whenever you do it. We don't currently have a foundation. We are getting to a size where that is a topic we're discussing. Because when we were small, it was, you can't do it, you couldn't do it, it wouldn't be practical. But we are now getting to a size of an agency that is an interest we need to look at. We provide the hydration and rehab services at working incidents, be it a structure fire, be it a disaster of some sort. We're on standby for the fire department and provide drinks, water, Gatorades, Powerade, or whatever the case may be. And that comes out of our operating budget. So in the case if somebody wanted to be impactful on something that would help their community, something like a case of water, or those things are really neat. We can't accept any kind of donations or anything directly. That obviously complicates things. But bringing a 24-pack of water or Gatorade by, it will certainly be utilized.
So if you're coming out to the open house, bring a case of water or a case of Gatorade.
And I'll go back to the cookies.
As you're dieting.
Briefly, I'll briefly go back to the cookies. The chief mentioned we have 170 staff, and we would both be remiss if we didn't turn that mirror around and point it towards them, because 100% of what we do is not Jimmy and I, nor Deputy Chief Malden or Clark. We sit in an office all day and come up with great ideas. We write policies, we make sure stuff, but the boots on the ground do the work, and they do phenomenal work. So love on them. You know what I mean? Like, it's not, we might not be able to take a $1,000 donation, but they would prefer you to come by and bring your kids and let your kids tell them how much, they mean to them, show them the truck, bring them some cookies, like whatever, but really just giving those folks some love and showing them that the community supports them, because they do some really crappy work sometimes in some really bad situations, and they do phenomenal. I go back, when we started COVID, it was like they were going into homes, everybody was locked down, and we were just bebopping up in people's houses who we knew had COVID, and our people did it. They just did it. Like it was, and and I'm sitting here going, I don't deserve these people. Like, I don't deserve to be around them, because even I would be like, I want to do this, and I would have done it. I mean, I've done this profession a long time, but they really do, they do great work. So, I would just say for right now, hopefully we can get to a foundation thing, but when you see a paramedic, buy their lunch, buy them a cup of coffee, just tell them thank you. You don't have to spend money. It goes a long way. So it really does.
They are definitely involved in more than just 911 calls. They are involved throughout the whole community in many
Keeping the
different.
community together.
Yes.
Yes.
Yeah, it's like we said, we take chaos and turn it into good a lot. So we're familiar with that, So.
Well, thank you guys both so much for being here
Thank you
and
for the
joining
opportunity.
us. We hope you all had a great time. These guys are incredible, doing incredible work in the community. You guys have any guest suggestions, or if you have any questions for us, you can email us at the CabCoPod@gmail.com and follow us on all social media at CabCo Collective. See you next Tuesday.
Thank y'all.